Okay, think about this for a second. Imagine a medication, one you probably know mainly for managing diabetes or maybe helping with weight loss. Now, what if that exact same drug had this, I don't know, hidden superpower? Like it could actually protect your brain, especially against something really scary like a stroke. It's pretty amazing, actually, how often medicine finds these, unexpected bonuses, things that go way beyond what a drug was first designed for. And yeah, that's exactly what we're diving into today. We're talking about these GLP-1 drugs. You've probably heard of Ozempic. There's some really groundbreaking new research suggesting they might seriously cut down stroke risk and maybe even boost recovery a lot.
It's exciting stuff, and it's really fresh. These findings just came out at the 22nd annual meeting of the Society of NeuroInterventional Surgery, SNIS. 3 new studies were presented there. And just for context, these GLP-1 drugs, glucagon-like peptide-1 meds, they basically copy a hormone your gut makes naturally. So, yeah, they've been huge for managing blood sugar and type 2 diabetes, and they help with weight loss by, affecting appetite. But what's really starting to emerge now is, well, their wider impact, including, it seems, significant effects inside the brain itself.
Right. So for you listening, our mission today is pretty straightforward. We're going to walk you through these, frankly, fascinating studies. We'll unpack what they discovered and really explore why this might be a whole new frontier in how we think about preventing strokes and caring for people afterwards.
Okay, so let's start with that first piece, maybe. How Ozempic could affect survival after someone actually has a stroke.
This first study, I think it was, from researchers at the University of Wisconsin-Madison, they looked specifically at whether stroke patients already taking Ozempic did better than those who weren't. And they pulled together a lot of data, right, from their own hospital and also a big international database.
They did. And the results were, well, pretty compelling. If you look at the global data set, first it was enormous. Over 2 million stroke patients.
2 million. Wow.
Yeah. And out of that huge group, more than 43,000 were also using Ozempic. Then they looked closer to home at their university's own data. That was over 13,500 stroke cases, and 190 of those patients were Ozempic users. And, across both data sets, large and small, the pattern was pretty consistent. People taking Ozempic had a significantly lower chance of dying from stroke-related issues compared to people not taking it.
Significantly lower, like how much lower?
Well, okay, get this. In that huge global data set, the initial death rate from stroke for Ozempic users was just over 5%.
Okay.
But for non-users, it was over 21%.
Whoa, that's a big difference right there.
It is. But here's maybe the even bigger number,
Yeah.
long-term survival. Ozempic users had a remarkable 77.5% chance of surviving their stroke long-term.
77.5.
Yep, compare that to just 30.95% for the non-Ozempic group.
Less than a third. Wow.
It's more than double the chance of long-term survival. And like I said, the university's smaller study showed basically the same dramatic kind of results. It really reinforces the finding.
That survival data is just, yeah, it's dramatic. Makes you wonder then, okay, could these drugs maybe help prevent strokes from even happening? What did the second study find about that?
Great question. And yeah, that takes us right to the second study, also from UW-Madison. This time they switched focus to prevention. They looked at a massive nationwide sample of emergency department records. They basically compared stroke patients to other ER patients who were likely using Ozempic, just trying to see if there were links.
Did they find anything?
They did find significant links, yeah. Clear connections between people who were likely Ozempic users and a noticeably lower chance of having a stroke in the first place.
So it suggests a protective effect then?
It does suggest that, yes. The researchers themselves pointed out, though, that for, even better proof, future studies really need to look directly at pharmacy records.
Ah, okay. To be absolutely sure who was taking what.
Exactly. Pharmacy data gives you that direct confirmation. But it does raise an interesting point, about using the data we already have in smarter ways.
Okay, so we've got potentially better survival after a stroke and maybe a lower risk of having one. But you mentioned 3 studies. What about recovery from other kinds of brain injuries?
Right, so let's pivot to that third study. This one broadened the scope quite a bit. It came from researchers at the University of Texas Medical Branch in Galveston. And they looked at whether GLP-1 meds could improve how patients do after brain hemorrhages.
So like brain bleeds.
Yeah, exactly. Both spontaneous bleeds and ones from, say, a ruptured aneurysm. And they also looked again at ischemic strokes, the blockage kind. And what's really compelling here is how they tracked patients over time. They checked patient records at 6 months and 12 months after the hemorrhages, and then at 1 year and 2 years after the ischemic strokes.
Okay, so longer-term follow-up. What did they see?
They found that using GLP-1 medications was consistently linked to a lower risk of several really critical bad outcomes during recovery. Things like fewer cognitive side effects, problems with thinking or memory. Also, fewer seizures, a lower chance of having another brain hemorrhage in the future, and really importantly, a lower risk of death after both types of injury, hemorrhage, and stroke.
So it seems to help across the board in recovery, too. Neuroprotection, maybe?
That's exactly the term. It strongly indicates some kind of neuroprotection and generally enhanced recovery. It's pretty powerful stuff when you line it all up.
Okay, so let's try and pull this together then. For you listening, what's the main takeaway from all this? It really seems quite profound, doesn't it? These GLP-1 drugs, which, like we said, we mostly think about for metabolic health, diabetes, weight, they're now showing this incredible potential for protecting the brain in a really broad way. We're talking about drugs that might, cut your risk of having a stroke, drastically improve your chances of surviving if you do have one, and even help you recover better from really devastating things like brain hemorrhages.
Absolutely. And if you think about the bigger picture, researchers involved, like Dr. Ahmed El-Bayoumi and Dr. Matthias Costa, they're echoing that excitement. Dr. Costa specifically said this research could offer a, quote, new perspective on preventing and lessening the awful effects of stroke and similar brain injuries.
That new perspective feels right.
It does. And just think back to those survival numbers again. That 77.5% long-term survival for Ozempic users versus, just under 31% for non-users in that big global study?
Yeah, those numbers are hard to ignore.
Exactly. Numbers like that, they could fundamentally change how we approach care after a stroke. Maybe even, who gets prioritized for certain kinds of follow-up or rehab. Now, of course, it's important to say both Dr. El-Bayoumi and Dr. Costa stress that, more research is certainly needed. These are early days, promising findings, but still initial.
Right. Caution is always needed in science.
Always. But the consistency and frankly, the size of the protective effects seen across these different studies, it's undeniably a pretty remarkable discovery.
It really is. And it makes you think, doesn't it? It raises this bigger question for you, for all of us. How might our whole understanding of how drugs work evolve? If medicines made for one thing can have these huge protective effects on totally different body systems, what could that mean for the future of medicine? Could our entire approach to really common, widespread problems like stroke be shifted by drugs we already have on the shelf? And maybe the most intriguing question is, how many other existing medications might be hiding similar, undiscovered benefits? Definitely something to keep thinking about.